Hi guys, welcome to Crosstalk, your local podcast brought to you by Republic Polytechnic Diploma in Mass Communications and Singapore Red Cross. Come and join us in hearing the conversations and perspectives of various Red Cross leaders.
We'll be covering various topics ranging from blood donation to caring for the elderly and many more. So get yourselves comfortable, maybe grab yourself some drinks and snacks because the conversations we're about to have is gonna be interesting. So stay tuned. Hi guys, welcome back to another episode of Crosstalk, a local podcast brought to you by the Republic Polytechnic Diploma in Mass Communication and Singapore Red Cross. I'm Nas.
And I'm Razik.
I would like to introduce you to two important guests from the Singapore Red Cross Academy, and they are...
I'm Yuping.
Hi, I'm Michelle from Singapore Red Cross Academy.
Okay!
Woo! You almost said I'm Michelle over there.
Yes.
Okay, so would you like to tell more about yourselves?
Okay, I'm Yuping. I'm actually one of the associate instructor under the Singapore Red Cross Academy. So basically, this is like my part-time job. I teach first aid classes while being a full-time SIT student. Yeah.
So for me, I'm a full-time staff with Singapore Red Cross Academy. Then, so what I do is probably just development stuff and also teaching day to day as well. Yeah.
Wow. So, are you a teacher or are you just an instructor?
Instructor lah, we call ourselves as instructors.
Oh,
yeah,
I
but
see.
we actually sort of doing similar roles as a teacher as well. So
Oh.
instead of like in day to day when in secondary school, your teachers actually teach us use math and stuff, right? So we teach us everyone first aid. So different courses day by day.
But who is the senior out of you two?
In terms of
Okay, let's not talk about age because women
No,
do that
age,
kind of
I'm not
age.
talking about age. I mean, as in, like, who is the senior instructor, like, from both of you?
we actually started off like quite together lah, like somewhat like same batch kind of thing. In terms of seniority, I would say she actually has more experience as compared to me. Yeah, correct.
Okay, so, can you tell us more? What is first aid actually?
Okay, so first aid. So if you actually just split the two words up, then it's actually like the aid that you do when you actually the first thing you do when you actually help the person, right? So if you were to actually bring in the definition, it's actually just the assistance that we render to the casualty before any paramedics or medical helps arrive to the scene. It's actually important, of course, because every seconds counts. So the earlier we actually help and render aid, right, the faster, like it will promotes the recovery of the casualty.
So you're like a paramedic, but in plain clothing.
We're the first responder in the
yeah.
community setting.
Oh, in the community setting.
yes.
Oh, okay.
Paramedics are like
Paramedic.
professional people that comes in. So
Ambulances,
That
yes.
the ambulance
I
and
would like
stuff.
to say that the first aider is like the bridge, so the middleman between the casualty to the paramedic. Yeah, so it's like the third person that actually helps them to link up, kind of thing.
Okay, wait, I need to ask. What do you think all these first aiders are paramedics?
No, what I meant was they would be the people they are like paramedics because they give CPR and whatnot, but they're not wearing, official uniform or anything. That's what I meant.
Okay,
Yeah.
pause on that. Do you guys have official uniforms besides the vest that you're wearing right now?
Oh, we wear vests when we teach class, but then we don't wear vests when we do first aid on someone.
You put on, right? You put on when someone gives you.
Yes, we are not Superman. So yeah, we don't do that. But as in like when we do first aid duty representing the Singapore Red Cross Society, we do have like a particular attire like to identify ourselves as first aiders. But of course, when we are out with our friends or out with our family members, when someone is in need of help, then of course we will just be wearing civilians costume or attire and then like attending to them lah. Yeah.
So you see, when I talk about first aid, it stirred some memories inside me. Back in 2016, right, I was actually a first aider. I certified because the school sent me.
Not bad.
He always brags about his certification.
Don't brag.
from
This
first
is the
aid.
first time I'm actually bragging. It's like this episode, right? So anyway, I was certified I think for about a year or two because I only practiced it once, right? So then I don't even see any casualties. So the reason why I did recertify because in my head back in 2016, I was like, I'm in the guitar club. Why do I even need first aid? And also my mom's a nurse at home. So what significance would that be for me? So I would like to know if what I was thinking was right, or is there any other opinion or perspective that you can provide to counter this opinion of mine?
I think it's nice to hear that your mom is a nurse. I think that's great. Like nurses are awesome people. But anyway, I think the reason why your school wants you to like get the certification, even though you're in guitar club, because any incident or accident can happen anywhere. Even like when you're in your CCA, something could happen, and then like your mom is not there because your mom is at the hospital attending the patients there. So it probably needs students like you guys to be on the ball, on the ground, to actually assist anyone that needs help. Then also, probably the reason why like more schools are advocating younger like youths to actually take out the course is because actually in Singapore we are trying to aim to have every first aid, at least one first aider in every home. So the best platform is actually through schools, law. Yeah, so that could be a possible reason too.
So nowadays, a lot of people actually comes to take courses. So they can be actually at the age of 12 all the way to actually 30, 40s or 50s. So usually when they actually come to attend the courses, right, they actually either something happened at home, so they know that, oh, okay, first aid is important, so that I need to be prepared to know, okay, so anything happen again, I will be able to actually take up the react accordingly. So some of the issues here is like that. They find the motivation to actually come for the course. Correct.
Then also, just to add on, I was just thinking like because of the experiences they had back home, right? That's why they come out first aid courses. That's why we, as first aid instructors, we always advocate to don't let incident happen already. Then you come for it. It's always prevention is better than cure. Like you want to be ready to be able to address the injuries or incident that took place, than to regret that you actually never learned. Then you go and learn. So that's why like we always advocate like if you have time, if you have the ability, you have the strength, you are young, you are like filled with energy, then why not come for first aid class? You'll just take maybe like 2 days of your time, and then you'll get certified and you get like lots of knowledge that you can actually have and be ready to help your loved ones or even like the neighborhood that you're living in.
I'll admit something. Since I've never learned anything about first aid or never even took like workshops or programs or whatever, I've never even attended when the school had a Singapore Red Cross event. Sorry, guilty. I did, however, read a poster from a clinic once what to do when someone's having a stroke, and I actually encountered someone having a stroke. So would first aid apply in that situation?
In our classes, we teach about stroke. We teach the understanding of how to recognize the stroke casualty, because for stroke cases, right, it's something like it could be a blood vessel that actually like bursts in the brain, or like there's a blood clot at the brain. And when this happens, every second counts. So for you to be able to identify someone with a stroke, it's very important, because this will help to increase the survival rate of a casualty. So yeah, in first aid, we do actually advocate for like recognizing of a stroke patient, even though you might not be able to do much because it's something about the brain. But for you to be able to call SCDF 995 is already a very good helping hand for the casualty there.
So, talking about stroke and all, right, and reacting to all of these possible scenarios that can happen out in Singapore, do you now think that first aid should be something that every youth should know?
We'll say that it's important, like what Yu Ping mentioned. So like what we actually want to advocate is actually having the one first aider in every home. So we actually encourage them from young, they actually learn first aid and everything. So we also like to emphasize, like, cause first aid is like life skill. A lot of people will think that it's just one time off kind of thing. But like you mentioned, right, you actually went for first aid classes. So right now, even if you didn't go for recertification, which I'm still not very sure why you actually didn't go for recertification, but you actually still remember bits and parts of things, right? Like, oh, I knew if let's say it's a bleeding, then I need to what will you do if let's say it's a bleeding
If
case?
it's a bleeding, we'll have to run it under cold water. No, that's burn. I just said it. Okay, I think it's just okay. You see, that's the thing. I think for me, right, this is coming from me personally. You are supposed to remember A, B, C, D. I remember A and D. That's it. The start and how is it supposed to look like initially and the after.
Yeah, that's why it's important for like learners to actually come back for refresher courses, and also because actually in first aid, right, there's a constant change or update in our curriculum based on the doctors or the team, the council members. They will constantly update the curriculum, and then there could be changes in the first aid methods and stuff. So sometimes our learners that come back for refresher, they realize, last time I didn't learn this. This is a new method. Then we'll explain the scientific reason behind why there's a change in the methods and stuff. And then they'll realize, okay, so it's actually good to come for refresher courses if you expired, you're so expired. Yeah. So you can consider.
Hey, Razik, maybe you can take lah. They're already offering,
Maybe. But I want to address like some concerns that people have, like especially my group age. when I saw the symptoms of someone having a stroke on that day, I had a traumatic experience because I didn't know exactly what to do. I just called. So let's address that for a moment. Why do you usually experience this reaction when it comes to performing first aid?
We'll assume that okay, because maybe they are actually not trained. So when they actually go for courses, we'll actually emphasize and advocate that you need to be calm when you actually experience and you actually find a casualty kind of thing. Then what are the step by step kind of guide to go through and stuff like that. So some of the youths might be scared of blood maybe. Then that's why they actually go for courses, or maybe they find that the courses is actually too long. Like, because usually now our standard first aid courses is 2 days. They are not able to actually afford to go for such a long courses. So that's why. But even being said that, we will still feel that it's actually more important to be prepared. Like, for example, like you actually mentioned, right, traumatic and stuff, right? So we are not able to actually react at that point in time. So when you actually go for courses, you'll be prepared. So you'll know what to do. So anything happens at home or the similar situation arise again, you're able to actually help and assist. Because every second counts. So the earlier we actually step in to assist, it will promote the recovery of the casualty better. Yeah.
But that being said also, actually for myself, when I first learned in secondary school, right, as a first aid, a Red Cross cadet, when I attend to a casualty, I also panic myself, even though I have the first aid skills in hand. Because I think as a youth, in general, you just don't know if you're doing the right thing or not, and then you are just worried about like making mistakes to the casualty and worsening the condition when I'm not supposed to worsen the condition. But by end of the day, when we reflect back, just fall back to the 4 Ps, which is the principles of first aid. Why are we doing first aid? And is my method, do I do this method? Can this method help this person? If yes, then I go ahead. If no, then okay, is there another method that I can address? Helping the person, always put the person before ourselves. Like, we have emotions lah, but after that, I think after you attend to the casualty and stuff, you feel like slightly affected, like the trauma that you feel and stuff. It's always good to speak to someone. Psychological first aid is very important also lah. As a first aider ourselves, we also need to know how to take care of our own mental health. So if you really feel like you want to help but you're scared, speak to someone about it. Try to help first. After that, go and speak to someone about it, talk about the situation you're at. That's what I did lah. That time when I encountered a CPR case, when I had to do CPR on the casualty, I reflected quite a few times, like thinking, did I do the correct method? Was my method right? Then I started to text my senior to talk about it.
I had the same. So I was like, I'm very nervous that I did something wrong.
So always speak to someone if you are like worried and concerned, because as in, I would say I would rather you to help than to just see a person being there and then not being helped by anybody.
Yeah, everybody high power.
Yes.
High power, still power. But it's okay. Both of you brought up something important. Like youths, Michelle brought up about youths finding it very mafan and very troublesome because too many days, right? Or 2 days, also too many days these days. And then also you also mentioned about being not confident and disinterested. So this is something I just came up with. What if, right, if a TikTok video about first aid was made, and then after that, it goes through the 4 Ps also, but it's a very fast 30-second video. Do you think that would actually interest youth more to take up first aid?
I think yes. And also actually Singapore Red Cross have this AR, augmented reality they actually created, whereby there will be this mannequin that will appear, and then you can do you can try
steps
to do
and everything. So we actually go through the steps of how do you actually perform CPR, the DRS ABC. So you actually prompts you step by step kind of thing. So this is one of the features that is actually been promoted by Singapore Red Cross.
Okay.
Are there any other features? Because I remember I was working at the Pasir Ris rehab center. There was this like pinball machine where you can perform the CPR. So was that done by you guys?
It's by a university. They actually did out a project, right?
So there's this station being set up at different SAFRA clubs. So the idea is to actually advocate and promote public to actually learn CPR. And that machine, right, when you actually compress, you'll be able to see whether you actually did your compression effectively or not, like whether you actually hit the depth of the compression and stuff like that. Yeah, so if I'm not mistaken, it's actually an initiative by Singapore Heart Foundation also. They actually collaborated.
Yeah.
Okay, so Yu Ping and Michelle, you have brought this doll here today. For those listeners who are wondering what this doll is, it's basically the mannequin for CPR training, right? If I'm not wrong. And what's the name again that you gave this?
Mini N.
Mini N. Don't even look like an N. So, on the topic of Mini N, right? It's so weird saying the name, but what has this dummy got to do with CPR at all?
So this is the mannequin that we usually use when we actually train or teach us CPR. So CPR is actually cardiopulmonary resuscitation. So we do CPR or we perform CPR when we actually find a casualty who is actually unconscious and not breathing. So when a casualty turns unconscious and not breathing, right, the heart stop pumping as well. So there's no circulation of oxygenated blood to our vital organs. So it's important for us to actually perform CPR right then, okay? Because every second counts. Because we need to do it within 4 to 6 minutes before the brain damage starts to occur. Because for every minute passed, right, 10% of survival rate decreases as each minute goes. So yeah, so it's our good buddy, I would say, for mannequins, and is a tool that we actually use to teach us our compression. So our learners will actually use this to practice.
So there are exact areas where you should push into the CPR.
Yes, correct. So for the mini end that you actually see here, there's this bulging component there, right? So that's the area that we actually compress do our compression. So in theory, if you were to actually refer to as in theory, if you actually go for courses, that area we call it the lower half of the sternum. Sternum is the medical word for breastbone.
Yes.
But in layman, right, like when you see a casualty, you won't be able to see where's the breastbone and anything, right? So we will actually say it's the at the center of the chest. So center of chest wise, you need to make sure that it's actually from your shoulders to around this about half your area. Yeah, it's not towards your to your legs. Because if you actually towards the legs, right, it's actually called the half body, not the chest. So you need to know exactly where's the chest. So at the center of the chest, that's the area where you're actually gonna compress. Because if you actually take it from the shoulder all the way to our legs, right, the center of this half body is actually called the xiphoid process. So it's a hollow area where we actually press in. We'll break the bone. Then we actually puncture through the liver that's behind, so causing more injury to the casualty. So that's where where we actually have some learners, right? They actually share with us like, when we actually do CPR, we can hear the cracking sound, like
Yes.
right,
Yeah.
So like they are not very sure, so they will actually start to hesitate, like whether am I doing the right thing? Yeah. So what we will tell them is that you need to move your hands lah. So maybe you're actually at the wrong position. That's where you will hear the cracking sound.
If you hear the crack, that means he's dead lah.
It's just the rib cage kind of
It's just the
like,
rib cage.
But then of course in our first aid classes, our CPR AD classes, we'll definitely correct our learners on the correct positioning, making sure that they practice and know like how they can locate the landmark properly and stuff. So that is what first aid instructors are there for lah, is to teach you all the right method to do good compression, quality CPR on a casualty that is unconscious and not breathing.
If I hear correctly, there is one song that can, help you guide through doing the 100 beats per minute, right? Which is the Bee Gees' "Staying Alive." Is that true? Or?
There's quite a few.
That's quite a few. Oh, that's quite a few.
I mean, like it's 100 to 120 beats per second, right? Or
per minute.
Per minute, per second.
The person died already lah. Okay, but yeah, I mean, it's interesting that there are songs to help out. So in like your courses, right, do you actually say this fact out loud, or is it just an unspoken fact that you can look up online?
So what we emphasize in class, right, like what we've been mentioned, is actually effective CPR compression. So in order to actually do effective CPR compression, we need to hit the depth of 4 to 6 cm, at least 4 to 6 cm. And then the rate of compression, like what y'all mentioned about the song and everything, the rate of compression has to be within 100 to 120 compression per minute. So usually what we do in class is we actually advocate them to count like 1 and 2 and 3 and 4 and 5 all the way to 30 lah. 5, 10, 15, 20, 25, 30. So this way. So in some of the learners that doesn't really know how to count, right? Because you need to do together when you do compressing and then you count. So with this rhythm, right, you can reach 115 compression per rhythm, which is within the
Within
range lah. Yeah.
You know,
Right.
if I was the one receiving the CPR and the person doing it was humming that song, I think I say I'd rather meet my God already at this point. I don't worry, I don't. At least if like because some songs are indeed it's good that songs are being used, you know, in classes and stuff. But I think some people, is there an instance where some people take this too far and, you know, try to joke? They will like, instead of taking this seriously, it'll get worse for them because they can't really take it seriously because of the songs.
Or they joke around.
Yeah.
That kind of thing.
Is there any instances?
I think so far for the learners that we actually encounter, they take it seriously because I think we actually start the object we set the objective at the start of the lesson to actually tell them that these things is a real case, and it can really happen anytime, anywhere. So when we actually set the objective at the start, they will actually, all the learners actually take it very seriously. So I mean, for my experience, I don't have any learners that actually take it lightly lah. But they are the one that actually ask me all these questions because like in theory we will say, oh, go with the beat 100 to 120. Then you will have this question like, so how do you really count 100 to 120? I mean, it's easy to say 100 to 120. I can teach you how to count 1 and 2 and 3 and 4, but my counting is different from your counting.
Yes.
Yeah, so this is where the music comes in handy.
Mhm.
Then I'm like, oh yes, okay, the rhythm, okay, I understand now. So this is some of the things that I actually teach in school lah. And we have learners that actually feedback and say that, hey, this is really very useful. So if I don't know how to count 1 and 2 and 3 and 4, then I can actually listen to the rhythm. Because what if the participant is actually a Mandarin, like they cannot speak English? Can I count in Chinese? Not, of course you can. It's not the counting what.
It's not counting, it's
the consistency
yes, correct.
that we actually want to focus more on.
So in the course of the 100 counting, right? When is the part where you start breathing in?
Okay, so
Okay, right now, right, because the syllabus changed, so actually lay rescuers like us, they are not medically trained. The only thing we need to do is just continuous chest compression until the paramedics arrive and tell you to stop because they're ready to take over. Or when there's an AED that comes to, and the pads are on, everything is ready, and the AED machine says analyzing heart rhythm, and then you can stop your CPR. Or when the casualty himself or herself starts breathing. So these are moments we can stop CPR. So right now, our CPR context, right, for all lay rescuers is just to do continuous chest compression.
So
Sorry, so you do it continuously until the paramedics arrive.
Until the 3 scenarios, like what Yupi mentioned. So in the past, like you learned before, right? SFA, as in first aid. So in the past, when they actually go through, they actually talk about the 30 chest compression to 2 ventilation.
Yes.
This is still in syllabus. But because there's a research that actually found out that, right, a lot of lay person or passerby, they are not willing to do CPR because of the ventilation.
Oh,
I mean, like,
I get it.
in
Yes.
this situation, like when we're actually in a pandemic, right, would you all be comfortable
You
to
can't
actually
you
do
touch
mouth to mouth
lip,
to the
yeah.
casualty? So a lot of people might think that, they have the misconception that, I cannot do ventilation, I don't want to do ventilation, so I don't do CPR. But in fact, with effective chest compression, effective chest compression, you can still actually increase the survival rate of the person, can still help the person
Even without
the
ventilation.
ventilation.
Okay.
So that's why we actually advocate more now on chest compression only, hands only compression, and then only the 3 scenarios that Ripi mentioned, then you will stop.
Okay.
So do you still remember the 3 scenarios?
Oh no. Don't test me.
Okay,
This
maybe
is not
right,
square.
okay, this is a good one. Maybe you want to repeat the 3 scenarios for us.
Okay, one more time. So it's when casualty starts breathing. Second is when paramedics ready to take over.
Okay.
And third is when the AED is analyzing the casualty's heart rhythm, you can stop CPR. So your turn.
I forgot instantly.
I just know AED say okay, can.
Analyzing. Okay.
Analyzing.
Casualty, breathing.
And then when the
Paramedics
arrive.
arrive. Yes.
Ready to take over.
We just swap everything.
Yeah.
Good enough. Yes.
Just these 3 scenarios lah. So in a situation that you don't know how to do compression, or you forgot about the steps and anything, right? So important thing is you call for SDDF 995. So the operator over on the other hand, right, they will be able to actually guide you through the steps. So they will ask you, so is the person breathing? So if let's say the person is not breathing, then can you start CPR right away? Then they will count with you. So they will actually focus and emphasize to push up, push fast. Hard as in need to reach the depth, and then fast is to actually go with the rhythm.
So earlier on, you said you had the first-hand experience in performing CPR, right? Can you tell us more about that?
I had two experiences actually, but both experiences are through the My Responder app that's initiated by SCDF. So actually, they will actually send notification to anyone that downloaded their app, and then we can choose to whether accept the case or reject the case if we are not able to attend to it. So that time I was volunteering under Red Cross Youth event. Then suddenly a notification came up. Then me and my friend went to attend to the case. It was inside one of the HDB houses lah. So when we reached, actually the paramedics are already there, and they're actually doing CPR on the casualty, and I think there were about like 3 or 4 of them around there. So me and my friend just went in to ask like, we are first aid trained, do you need our help? Then I think also maybe because we are wearing our Red Cross uniform, so they recognized probably our logo or something. Then they felt like, okay, maybe they can get our help. So they got us to gather information about the casualties, past medical history, and then help them to like pack up, ask the family members to take the IC and stuff. So we try to do more psychological first aid care for the family members that are there. Then after that, halfway through, the paramedics asked if we learned have we done CPR before? Then we said yes, we have been training like people with CPR. So I went forward to help out, and I took over one of the paramedics CPR. So I just continued doing chest compression while the paramedics went to did the ventilations, get ready the stretcher, and then I just stayed with the casualty and one of the paramedic that is doing the ventilation, and another one doing the AED pads. So we are working in a 3-man team.
That one, right?
The one that they paste on the person's body.
The one on top and one on the bottom.
correct.
The huts there. Yeah.
So it was like a 3-man team working together. So I was the first responder that's helping doing the compression. Then there's one paramedic doing the ventilation, and then there's another paramedic doing the AED. So that was a team effort. Then I think after a while, like about 4 minutes or so, then the paramedics said, okay, we are ready to go. Let's send the casualty to the hospital. And then we helped to transport the casualty on the stretcher, and they took off.
Okay, that's interesting. Actually, that you become part of the 3-man team. So is it just you're working with SCDF, right? So that means it's people that you first never even meet before. So how does it feel like to work alongside someone to save someone's life?
I think as in probably at that point of time, me and my friend attending to the case is our first thought is like the paramedics were not there yet. That's why we wanted to reach the scene first and then like help as much as we can till the paramedics arrive. Being there, when we reached the scene, right, and we saw paramedics, we felt reassured, like, wow, the paramedics reaction very fast and efficient. So but then we thought like, since we are here already, we might as well just ask if they need an extra hand. How we felt about it, I think as in like the paramedics were quite appreciative of our assistance. We were quite afraid that they might they look like, because we are just first responders, right? So they might think that we might not be of any assistance to them, but actually they do appreciate all help that is given. So if let's say you are just a passerby walking past and you see paramedics attending to a case, out of courtesy, you can just try to ask like, oh, do you need my help? I can help. I'm a first aid trained person, or like I've learned first aid before, though expired, but then you still remember some basic skills. You can still check out with them and see whether they need help. So they are sometimes they are quite appreciative when extra help is able to be there for them lah. Yeah.
You mentioned psychological first aid just now. What were some of the questions to comfort the victims' family members?
Asking them to do things to let them feel like, oh, okay, I can value add to the situation now. I can help my dad to do something. I can help my husband do something. So like we just ask them to like gather some of the items that they need to bring to the hospital, and like and just check in with them. Like sometimes we might not even need to check in like how they are feeling, because at that point of time it's already quite like a critical situation for the whole family. So the only thing we could do is to like be there for them, and then just slowly instructing them like, okay, maybe you can help me to mother, you can find your husband's IC, then daughter, you can go and get your dad's clothes and stuff so that y'all can go head to the hospital once the paramedics are ready. And then we get them to like pack up a little bit. So it was more of like organizing their thoughts and then getting them settled a little bit more. It really depends on that point of time what the family members need. At the point of time, the family members need to know I think more of like what are they supposed to do now, because right now their father or their husband is lying there on the ground. They can't do anything because they have no first aid experiences. They are just standing there uncertain of like feeling super helpless at that point of time. So what we can do is just
in a sense getting the act together.
Yes.
Keeping it cool. Keeping it cool.
There's another word we can describe that, but I'm not going to use it, of course. Yeah. But of course, being there to help people, I'm pretty sure it's very interesting. You know, it's like you are impacting someone's life in a positive way. So in a sense, I would say, do you feel good about it? Like, do you think these small nuances where you help people, and any of you can answer this, or maybe both of you give also be good.
Do you feel heroic?
Yeah, do you feel
Yeah.
heroic? Is it
Like-
more heroic, like what he said?
Yeah.
I feel it's important for us to be able to be the first responder in the public, in the community, to help others, because like what we mentioned earlier on, we are trying to like advocate to have a first aider in every home, so that we are always ready to help when there's an emergency happen, be it big or small. There's always a first aider or first responder there ready to help. Yeah.
Okay. Yeah, that's a very, very good answer. So after this talk about CPR, you know, we've been discussing and all. I guess it's time we can move on to the demo. What do you think, Razik?
Yeah, we can try to perform on this mini N, right? That's her
Yes.
name.
Yeah.
And for our audio listeners, you can check out on Singapore's Singapore Red Cross YouTube channel to see the full video of us doing this CPR as a demonstration. Okay, so there are some misconceptions that Naz and I have heard about CPR, first aid especially. So can you address some of them, whether it is fact or whether it is fiction? Okay, so the first one is, when someone has a head injury, we should do everything we can to keep them awake.
It's important for us to actually talk to the casualty. So when we actually find a casualty, it's important for us to actually reassure, give comfort. So the important thing we actually like to emphasize here is to actually monitor the vital signs of the casualty. So if you're actually able to actually talk to the casualty, keep them awake, that will be good. But if let's say they actually went into unconscious state, then you need to know what to do lah. And react accordingly. The important thing is to be there and monitor the vitals of the casualty.
Then in our first aid classes, we also will teach our learners a little bit more in depth of how to recognize someone that's conscious, semi-conscious, or unconscious, like signs and symptoms to recognize, like this thing called the AVPU. So actually, if you are keen to find out more about or to learn more about first aid and learn a little more in depth, right, you can check out our Singapore Red Cross website, which is called the redcross.sg website. Yeah, just check it in and sign up for our classes.
Maybe I will.
Okay, she hinting ready.
Yeah,
so
yeah.
better go sign up.
If she doesn't see me, I'm dead.
Okay, so the second one, right? Okay, let me think off the top of my head. Which one is it? Oh, I remember now. If there's a burn on your hand or anywhere on your body, you put toothpaste. Is that true or false?
The reason why people put toothpaste, right, is because they want to cool it off. The reasoning for cooling is true, but then putting toothpaste is false, because toothpaste might cause some allergic reaction we don't know, or it could be like a bit dirty and stuff. So actually, tap water running down. What do you call it?
Running
tap water. Running down water.
Oh my god, yeah. It is good enough. Yeah.
Oh,
Okay.
so that's good enough already.
Yes.
I've been doing it all wrong my whole life.
Okay, all right. So the third one is, when someone is having a seizure, stuff something into their mouth for them to bite on. Is that fact or fiction?
Okay, so when you actually found a casualty who's having seizure, or fits, we usually call, make sure that you never stuff anything into the mouth, because by doing that, you're actually causing more injuries to the casualty. Because when the casualty is having seizure or fits, the muscles tends to be tense up. So when they actually force open the mouth and anything, right, you're actually causing more harm to the casualty. So what we need to do as a first aider is to actually just make sure you will actually follow the acronym action. So A stands for
Assessing the
the
environment.
danger. Yeah, make sure there's no hard object around the casualty. Then C refers to cushioning. So you cushion the head area, because the head is the most important part of the casualty of our body, right? So you cushion the area, put a bag or pillow underneath supporting the head. Then what's after C? T is the time. So the time of the duration of the seizures lah. Then I is the identity. So like whether the casualty has any tag around to actually say that he or she actually has a seizure case before, things like that. O is over. So it's to see how long the seizure over, and then once it's over, put the casualty into recovery position, as in tilt them to one side to allow the airflow of the casualty, opening the area of the casualty lah. Then all this you will learn this in our first aid courses also. So after O is
N.
N. and which is never lah, like what we mentioned, never stuff anything into the mouth, never give any food or drinks to the casualty, never restrain the casualty as well. Because there's this common myth that we need to restrain the casualty, prevent them from like jerking around, hitting and causing more injuries. But when you actually restrain them, this is the part where you actually cause more harm.
Or is it because the body you are
Because they are tensing the
involuntary?
muscle.
Yes.
Yes, correct. It's tensing up.
Now I know why it takes the course 2 days, because you have to learn a lot of acronyms, right?
Bro, 70 pages.
70, yeah.
pages. And like the test, I think if I'm not wrong, is only is a short quiz, right? At the end.
MCQ.
Yes. You imagine you have to set it for 1 hour.
Okay, last one. Lean forward when you have a nosebleed. Otherwise, the blood will flow into your eyes and brain. Is that true?
It's half true, as in the method that I still do, which is to lean forward, pinch the bridge of your nose, hold it there, and allow the blood to stop. That one is true. But then the reason why we are doing that is not to prevent the blood to flow to your eyes and your where?
Brain.
And your brain. So it's not. The reason why we are doing that is because we don't want the blood to flow back and choke your airway.
Oh yes, because it's
Oh.
literally
Yes.
connected.
It's connected
right?
to your mouth and okay.
So that's the reason why we lean forward and pinch the nose. Adding pressure will help to slow down the blood, to slow down the bleeding process as well.
What if people blow the blood out? You know, like blowing out the
Like
nose?
sneezing out, right?
Would
Like,
it be wise to do that?
We wouldn't advise that because you're actually creating more like abrasion or like movement at the open wound area, which might cause even more bleeding.
Oh,
So it's
you
best to
let it
just
flow.
add slight pressure at the bridge of your nose, then you just lean down, lean forward.
Okay. Okay, so now that we've covered all of those misconceptions, I think I've learned a lot today. Like
Yeah.
of course, like I said earlier, paise the toothpaste thing. I also do. Right? It's like a typical grandmother. It's a grandmother's cure to every burn. And growing up in Singapore, of course, all these things come into come into play. So of course, I think after talking with you guys for quite a bit already, I've learned some things, like some new things, some old things that I've rediscovered also with first aid, and after that we talked about CPR, and really it was really interesting because as you can see, there are that one learning point that I think that I resonated with was the first aider in every household, because I think that is important since we are trying to preserve our family's livelihoods, and also we can at the same time help other Singaporeans as well. So with that, right, do you have anything else that you want to say before we kind of close it off?
Okay, so you can actually we would like to encourage more youth to actually sign up for our courses. So you can actually go to our website to find out the various courses available. So just now you mentioned 2 days is too long, right?
Yes.
So we actually have like a 1 day course that actually consists of a 4 hours first aid modules. So all the common injuries, all the treatments and everything. And then another 4 hours on CPR plus AD. Everything in 1 day. So all this information you can actually go to our website at redcross.sg, or you can actually go to our Facebook at SG Red Cross. So all this information you can actually find is available online. Yeah.
Okay.
I think I might just sign up for it because now after learning so much and you guys sharing your experience, especially I have a grandmother who's suffering dementia and she might have a stroke, so maybe I will take part in it. So to end it off, I think I'd like to thank Michelle and Yupin for being our guest today.
And so thank you again for being our guest today. And we have learned so many things about first aid, CPR, and even cleared up some misconceptions that all of us grew up having with. So Razik, do you think it was informative?
Yeah, it is very informative.
So I hope our listeners out there, right, they will truly appreciate these small little nuggets of information with regards to first aid, and maybe it will inspire the first aider in you. So with that, thank you again everyone for listening in to Crosstalk. See you again in the next episode. Thank you for listening to another episode of Crosstalk. Hope you enjoyed it. Stay tuned for more episodes.